Hey guys, welcome to PiCClip, a tamper-evident IV guard. So first of all, what is a PICC line? Well, it's a peripherally inserted central catheter. And so what it is it's a catheter that's inserted that goes directly to the heart and delivers medications or is used for patients with difficult venous access. And 2.7 million PICC lines are actually inserted every year in the United States. It's a very massive market for potential device development. And so the general course of a PICC line is that they're usually inserted as part of a hospital stay or an outpatient procedure. And the patient actually goes home with the line, so they don't have to reinsert the line itself. And they'll occasionally come back to the clinic for treatment for injections of antibiotics or chemotherapy. The issue with this is that in general, intravenous drug users often require PICC line placements just because they're at higher risk for infection. However, intravenous drug users who have these lines and also abuse them when they're at home to inject drugs is actually associated with worse outcomes. And if tampering is evident, there's actually a clinical need to reevaluate them for readmission or transition to oral antibiotics, which are actually less effective. And so the current approach that some groups have come up with is something called a tamper-evident approach, where a group in Singapore essentially just placed a seal over the PICC line itself so that when the PICC line was tampered with, they'd be able to tell. The main issue with this is that it doesn't really show how often the PICC line has been abused, because frequency is really important because it correlates with increased risk of bacteria-mediated infection, just because the more times that you introduce foreign material into the PICC line, the more often you'll get infections. And so we designed something called the PiccClip, which is actually a clip that goes around the access ports. And it's tamper-evident, but it also records the number of times the clip has been opened and closed using a circuit inside an RFID module. And so it can detect this via two little dots here and this rectangle that essentially acts as a switch. So when the clip is closed, the circuit is closed, and it can detect that. And when it's opened, the circuit is disconnected. It also records the duration that the clip has been opened for additional information. So as a proof of concept, we use IFTTT to essentially simulate what would happen if the clip is open. So I can press a button on my phone, and what that does is it'll iterate the count on this IFTTT applet, and it'll send a text message to me that'll say the number of times it's been removed and actually how long it's been open for. And so here's a general CAD model that we designed in SolidWorks. So here you can see the PICC line itself and the clip that goes over the access ports. And so this would be the normal position. And if you were to open it, you can see here how the switch would be opened and the circuit would be disconnected. And here's our general circuit. It's very simple. And then you can scan the RFID chip that's inside the circuit itself, and this will be the output that the clinician can see and actually use. Thank you so much.